This is Caroline.
Mary Tess.
Neil.
And this is Laura. Welcome to Med Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med Surg nurses, just like you, sharing our stories, insights, and experiences to support you in your nursing journey. Today, we're sharing our own personal stories of hope about patients who touched our lives. But before we get started, let's see what's new with everyone. Laura, why don't you start?
Hi, Neil. Well, things are just fine with me. It's kind of a strange time here in Texas. Last week, our world was frozen and shut down, and today it was almost 90. So strange times here in Texas. Other than that, I'm doing okay. Caroline, what's going on with you?
Still in survey prep mode at the hospital. We anticipated them coming this week, and they didn't actually come after we all stayed late to prep one last time yesterday, but they're at another hospital in the area, so we get another reprieve for a week. That's the big focus in work life right now. Mary Tess, what's going on with you?
I wanted to share updates with regards to my mom-in-law's birthday, and I'm so very proud of my kids. They surprised her with gifts, and these are handmade gifts. So one gave a painting, another made a crochet. I can't believe it. My teenager knows how to crochet. It's a flower, but it's handmade crochet. So very special. So she was really very happy about it. So that's what's going on.
That's wonderful. She'll treasure that forever. You know she will. That's great.
I hear ya. You're right. Neil, share something. Yeah.
Good news. I know I've been talking about it for a while, but I've finally decided to enroll at UNCW for my MSN in education.
Yay. Congrats.
And I'm in the process of accepting a PRN, very PRN position at our outpatient radiology cancer center. Kind of just being relief for vacation for the office there. A former coworker that's a worker there now, a PA, and reached out to me and said, I loved working with you on oncology. Really think this would be a great spot for you to help fill in. So I went and did a little tour and extended an offers to just help out with vacation spots. And I think it has a future investment in doing radiation oncology, which is a passion of mine, which kind of brings us to our topic today. Today's topic is one I suggested, stories of hope, when our patients touch our lives. And since it's my topic, I thought I'd start with my background as to why I chose this topic. Believe it or not, I am a 20-plus year cancer survivor. It's one of those things I tend to remember when I am nursing. What an impact all those nurses made on me, whether they were the inpatient nurses, the one or two times I went neutropenic and had to be admitted, or my chemo nurses when I was going for my outpatient chemotherapy every other day, it seemed like. Most recently, I had a young man who plays football at one of the local colleges who was admitted for a reason other than his oncology diagnosis. He was about 21, mother by the bedside. I walked into that room and it just hit me. I saw this young man with this brave battle after his freshman year of college, playing sports on a full scholarship. He turns around and has lung cancer. I saw myself in that bed, a young man with just such an amazing attitude and such a positive energy, going through not only the emergency he was having at the time, but such a long battle with something like cancer. I just looked at his mom. She's just so much reminded me of my mother, just by that bedside wanting to know everything that's going on. I said, I love your questioning attitude. As we're always told, practice with a questioning attitude. And I want them to question things. Sometimes they know things beyond what we know of their situation. You know, not everything comes out in their medical record all the time. Purchased a t-shirt from his school's website in support of him And I've been in touch with him since, just telling him people are thinking about you, people are praying for you. I had shared my story with him. It was just a great moment to be human again. Probably one of my most amazing weeks I had nursing.
That's awesome. You got me emotional. I think it's so powerful when you get connected to either a person's personal experience, but also to be connected because you had that personal experience as well. So you got me like, oh my goodness. My story, I'll share. My father is a Boy Scout volunteer. My mom is in the Red Cross. And as little kids, they will push us to, can you go do your BLS training? I don't even understand why I had to do it. I was like, okay, let me do it. I learned how to splint and all these, but there was no meaning. But when I was a teenager, someone passed out and everybody's just gathering around. And I see this man just doing compressions, seeing the person coming back to life. I was like, that is a superpower. That's really one of the most powerful. But when I became a nurse, I was taking care of a patient. The patient was admitted because of confusion. He's about 70 years old. This patient was just sitting on the bed, not moving at all. And so when I asked, can you walk? Is it okay that you stand up? And he said, no, I can't walk. And he was very blunt. And so I didn't want to ask further. And I said, can I take off your sheets? And he said, yes and no, kind of like hesitant. And I said, can I just take a peek? When I removed the blanket, the legs were so thin and atrophied. When I saw his back, he has a wound as big as a baseball, and you can almost see his bones. And so it was not even in his medical history that he is paralyzed. And so the nurse and I, we were looking at each other because he was admitted more than 24 hours. I said, I see you have a wound. How long have you had this wound? And he started crying. That silent moment is just so powerful. It's telling me a lot of stories, a lot of words, but letting me know that this is what you're made for. You're here to serve others. You're a vehicle of serving and caring for other people.
Yeah, that's a great recollection, Mary Tessa. And to you, Neil, I applaud you for going into the nursing profession and knowing that every time you take care of someone or hear of someone on chemotherapy, that's a trigger for you. In nursing, we come into contact with so many people, and oftentimes the job can get almost routine, and then all of a sudden someone will come along and it will really be that moment where you think, yeah, like Mary Tess, you just said, this is the reason I do what I do.
As many of you know, I started on an oncology floor as a brand new nurse. And at that point in my career, patients were coming into the hospital and they were staying for weeks at a time. So I got to know families very, very well. And I have one special young man that's always going to be in my heart. He was 19 years old when I took care of him. He had been struggling with leukemia. At some point, he did go into remission, and he left the hospital with a drug problem. He struggled with that for a while and ended up coming back in the hospital with a relapse of his leukemia. So there were some very strong dynamics in that room. His parents were fighting us on medicating him for pain. I was still a very young nurse and didn't really understand all the ins and outs, but what I did know was looking at that patient's face whenever he was in so much pain. I used his story to teach myself how to advocate for patients. So I worked very closely with the doctors, and I watched how these doctors talked to these parents about how important it was for him to be medicated for pain. They were already convinced that he was going to make it through this bout of leukemia, so they didn't want him to get hooked on the medications again. So that's where their heart was. But as his symptoms progressed, as his disease progressed, we had to let them know that we're not going to come through this bout. Seeing them really re-engage with him and recognize how much he needed that pain medication and how much more comfortable he was when he got it, we were able to shift his focus towards quality of life. So we got him medicated and comfortable, and then his family started showing up to visit with him. So they were bringing snacks, they were bringing movies, they were bringing video games. We got to see all of these families interact with each other, and I think it really made a difference to him while he was in the hospital. He was able to go home, and ultimately he did pass away a few months after he was discharged. Just seeing that family get back together and focus on making him comfortable, there was some joy in that room near the end there. And that has always made me realize how powerful I can be as an advocate for my patients. That gave me hope.
Wow, what a wonderful story. Gosh, thank you for sharing that. What valuable lessons that you've taken away and never forgotten. That's amazing. I have lots of stories, but this young nurse was in one of the first residency programs that I put together. 21 years old, just married, beautiful girl, her whole life ahead of her. And just a couple of weeks before Christmas, she got diagnosed with Hodgkin's lymphoma. "21 years of age," and I can see how this episode can be getting really emotional and difficult to get these stories out. At a time when most 21-year-olds are worried about passing boards, getting their first nursing job, finding a boyfriend or a girlfriend, or getting in a relationship. And there she was, essentially in the fight of her life. When she got her diagnosis, she was so matter-of-fact about it, so pragmatic. Well, okay, we'll get through this. We'll figure out what to do. One of our goals as a newly married couple is to have children. So we're going to freeze our eggs. So I don't have money to freeze eggs, so we're going to set up a GoFundMe. And without any hesitation, of course, people donated a significant amount of money so that she could freeze her eggs. But I'm going to fast forward now almost 7 years. Not only is she in remission, she has not one but 3 beautiful children. Her family has blossomed, and she's a wonderful nurse, and such a story of optimism. It put things in so much perspective. Don't sweat the small stuff. And it's the same with the patients that I've taken care of over the years. Certainly the years that I was in renal transplant, patients that would be called, "We've got a kidney, come on in." "Oh, you're not a match." "You've got a kidney, come on in." "Oh, you're not a match." And this constant up and down and up and down. And then finally they arrive one day and you draw the blood and they think, well, I'm not even going to get my hopes up because, I haven't even had a match. And then it ends up being a perfect 6-antigen match. And then, of course, you have all of the stories of hope and optimism that go there as well. So we put ourselves in these situations sometimes and we wonder, what the heck are we doing? Why don't I just work anywhere but in healthcare? But it's these moments that mold us, I think, and give us such perspective and optimism as we move forward.
A great story, Caroline. Neil, thank you for sharing your journey with us.
Yeah.
I can imagine there's probably more that you can share about that, but I applaud you for taking that experience and using it to fuel your passion for nursing and caring for people and connecting with people.
To be honest with you, I was 19 at the time, and it used to be a trigger for quite some time just to even walk into a hospital. So the fact that I, as a CNA working through nursing school, worked on oncology, let alone returning to do it for the radiation part of a part-time job, there's always going to be a chance to take care of an oncology patient, even though you're not on an oncology floor, just because they'll come in with other crises in between. It definitely has gotten better over the years. And I think we all carry some kind of health battle wounds. The lesson I learned was just to take each day as a gift. You know, they always say,
Right.
you know, yesterday was the past, tomorrow is the future, today's the present. It's a gift. Unwrap it and cherish it. I also tend to say, life's cake. I wake up, my feet hit the floor, the flavor of the icing I put on, it's up to me. I like food.
Something to think about. Absolutely.
There's no better perspective than going through something yourself. Even just being a patient, it doesn't matter if you're in the hospital for anything, but being a patient, especially when you're a healthcare provider, is a very sobering experience. So I've had my run-in with that over the years, and it's amazing what you see and what you hear when the healthcare team is coming in and out of your room and going about their job, and you know why they're doing what they're doing, but the things that they say and they do, and you think, goodness, you know, this doesn't necessarily come over the way it should do. I know you're meaning well, but think about someone who doesn't have any medical knowledge, how scary this might be or how uncomfortable this might be.
I can tell you, Caroline, it's even worse when you are the loved one or the family member.
Oh.
You've got somebody that you love sitting in that bed. I now have a lot more empathy, I think, for the family members because I know what it's like. There's nothing that's going to calm them down.
That's right.
It's really a horrible, horrible feeling.
That's right.
When you feel helpless.
Yes, you feel really helpless. My mother tripped and fell and dislocated her shoulder on Christmas Eve, and we went to the ER at the hospital where I work, and everything was going just fine until they had to give her some propofol to knock her out so they could put this shoulder back in place, and her eyes rolled to the back of her head, and she looked, I'm like, oh my God, wake her up. Complete panic mode.
Even though you know exactly what's going to happen.
Exactly. One of these funny, not funny situations, but you're absolutely right. When it's someone on the other side that you love, it's like, oh my goodness, oh boy. But again, perspective. Now I know when little elderly men and women come in to my orthopedic floor with broken bones and their family members are fussing around and worried, and I know exactly how they feel.
You tailor the way that you take care of them based on your prior experiences. So that's what is so important when you're on the floor like that, is to take each experience and help it enhance the future interactions that you have with patients like that. I have one story that I would like to share. The hospital that I grew up in when I was a baby nurse was near a state school. So I don't know if any of you have ever taken care of patients from a state school, but a lot of them are developmentally challenged, mentally challenged, and they're sometimes a little bit difficult to take care of. Sometimes they're largely nonverbal, or they have the mentality of a child and they can't comprehend. You can't really teach them the way you would teach another patient. And a lot of times these patients were being over-sedated, or maybe not checked on as often as they should be. And I have one patient's face in my head. He had a family member come visit him, and they opened a whole world to me about him. He actually has the mentality to answer you, and he can laugh at jokes, and he can color. He could do all of these things, and we just didn't know. No one had taken the time to get to know that about him. And it does take some time to dig in a chart. Sometimes these patients come from their group homes with a folder of information. And on a med surg floor, you don't always have time to go through every single page. But after that family member was there, we had markers and coloring book for him, and he was just as happy as can be. And if you turned on some music, you could see him dance and, bob his head, and he became so much fun. I loved going in there to take care of him. So it taught me going forward to really take time to find out what is the key with this particular patient. When we get more of those patients, sometimes you just want to shake your head because they're going to take up a lot more of your day than maybe you have time to allot for them. But if you take time to find out what the key is, it can make your day go a lot smoother.
I agree entirely, 100% spot on. I mean, it doesn't get any better than that. It's always something to take away.
I still see his little face. We turned the music on and he was sitting there coloring, and you would see his head just move with the music, and he was smiling. He wasn't feeling all that great, but just that little bit of time that I was able to smile with him and give him his fresh markers, he just lit up, and it just made my day.
There's always a spark of hope. There's always beauty in every bad situation, as you may say, because they're in the hospital. But there is hope. The fact that they are facing it with a positive attitude. And Neil, you're so brave, and having that attitude that you can face any challenge, that's amazing.
Speaking from my background of education, we do encounter children with special needs every once in a while as adults in the hospital. I always call it cracking the matrix of how do I communicate? How do I engage, entertain, comfort these patients that are just a little different than the average patient we face? And sometimes it is hard in the Med Surg 4 with 6 or 7 patients for that day or night shift. And learning the communication styles, like I said, not all group homes send a little background on them. They're sent out. And I always say, whether it's between the adults I worked with special needs or even my father when he lost the ability to speak, the eyes say so much. Even verbal people, even ourselves, our eyes, unfortunately masks only say half our faces. Sometimes our eyes give away what we're communicating. It's great to make those connections with patients, young and old, of different backgrounds. And that comfort that we can aid with somebody of making that connection definitely gives them that comfort that no pill can give.
Yeah, it's worth a phone call. It's worth a little extra digging. If you're finding a patient a little challenging like that, it's worth it to try to dig a little bit and see if there's something that works when they're at home. Just because they can't tell you doesn't mean that someone doesn't know the answer to that question. On admission, it's a good opportunity to try to ask, because you got family members, or sometimes these group homes will send a sitter or somebody with the patient that has a little bit more knowledge. Grab on to that family member or that person with the patient and ask these kinds of questions, especially if the patient has trouble communicating with you.
So many times we're in a rush to get these patients in and get them out again, but it's the details, it's the story, it's what led them to come to the hospital. What else is going on at home? What barriers do we have for discharge? And I work with one particular nurse, and she knows every last little detail about her patients and their families, sometimes almost to extreme. We kind of joke and we'll say, well, if you want to know what this patient's inside leg measurement is, go ask Laura, because she will know exactly what that is. There's always something to be unearthed and put everything once again into perspective. We just take a moment to sit and listen to the story. Because to make any kind of objective decision, you have to have the whole story. And oftentimes, as Med Surg nurses, time just doesn't allow that. But just to take a few minutes just to listen and find out what happened can be just very valuable on the other side. I just discovered today a little patient who'd been dragging her feet about going home, and we missed a very important component. She was homeless, and she'd been living with friends and bouncing around from home to home. And then we got her a place in a personal care home, but her life is her 50-pound dog, and this personal care home would not take the dog. And so we can't discharge her right now. When you know the whole story, you kind of almost back off a little bit about saying, well, you're medically clear, you have to leave, here's your discharge orders, why aren't you going? She's got nowhere to go. And the place that she can go doesn't take her biggest support system in life, and that's her dog. And unless we'd taken a moment to just question and talk to us some more about this, we would never have known.
I think this really ties back to our topic here, the stories of hope, because how much hope do you think your patient has now that she sees that you're listening to her concerns about her dog? I mean, you're holding her discharge and you're doing everything you can to try to find another place for her. That's going to make her feel so good. I'm sure that she appreciates the lengths that you're going to, and that can happen for all of our patients.
Most definitely.
I think of that great saying, nobody cares how much you know until they know how much you care. And that's that story of hope. And you know someone cares about you, that there is a chance that this can be done right. Because so many times patients along those lines that might be transient or not have as easy as a time discharging without a home or home health, that there's hope this time that I could get this right. And whether we're talking med surg or psych or any kind of rehab.
For sure. That's a great expression. In my office, I have the Maya Angelou famous quote. I've learned that people will forget what you said, people will forget what you did, but they will never forget how you made them feel.
Yeah, that quote rings very true for us as med surg nurses.
Well, believe it or not, we're just about out of time. But before we go, let's quickly summarize what we've learned. These stories and moments remind us why we do what we do as med surg nurses. And it's these moments that mold us as med surg nurses. The suffering of others humbles us, gives us perspective, and deepens our empathy. Take time to dig a little deeper and find out the key to each patient to unlock your connection with them, to create a higher level of patient comfort and care. There is beauty and hope in every situation. Seek the whole patient story and ask the right question to determine the best plan for each patient. That starts with a great assessment. People don't care how much you know until they know how much you care. And Maya Angelou taught us that people will never forget how you made them feel. Thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med Surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official Med Surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org.
I'd also like to remind you to become a member at AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the Med Surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend Med Surg Moments wherever you get your podcasts to help us reach even more listeners.
I invite you to join the conversation by sharing your ideas and questions on AMSN's Facebook, Instagram, LinkedIn, or Twitter pages. And don't forget to add hashtag MedSurgMoments to your posts. Simply enter AMSN in the search field on any of these social media platforms to connect with us.
The content within the Med Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Caroline.
Laura.
Neil.
And this is Meredith. And always remember, Med Surg Moments is a moment in our lives, a moment in our med surg careers that makes a huge difference.